Hello, and welcome to our discussion on measles. I'm Dr. Cherry Brandstater. I do family medicine with Beaver Medical Group in Redlands. One of the important things for us to consider here is that since the beginning of this year, there have been more than 1,000 cases of measles. That is more cases than there have been since 1992. In fact, in 2000, we were given the status of having an eliminated disease process. If the statistics continue to climb, we continue to have cases through the fall of this year, our elimination status will be revoked. And we really don't want that to happen. Dr. Veronica Dixon is a pediatrician with Beaver in Redlands. What is measles? What are the signs and symptoms?
Measles is an awful disease that makes kids or adults with it very, very sick. It usually starts with fever and then quickly followed by a rash that starts up by the hairline and then spreads down the face and then down the body. And there's also, at the beginning, red eyes and a very, very stuffy nose and bad coughing. It can progress and really cause high fever that lasts over 5 days. And about 1 in 5 people who get measles are admitted to the hospital because they're so sick, usually with pneumonia.
So it's not just bumps.
No.
It's actually a bad actor.
It's a terrible disease.
And Dr. Kazemi, could you give us a little history of measles in the United States?
Absolutely, I'll be glad to. Prior to 1963, where the routine immunization for measles started in this country, there were approximately 3 to 4 million folks that they got measles every year in this country, in the United States alone. In 1989, we had an outbreak in school-age children who were already vaccinated. So 3 bodies of the medical societies came out with the statement saying the second dose was necessary. And these were Committee on Immunization Practices, American Academy of Pediatrics, and American Academy of Family Physicians.
So that was the change. They added a second immunization for it. And Dr. Dixon, what were the results of those changes?
It was great, actually, with this implementation of the school entry vaccine. Measles cases went down so far in this country that, as you said, we did get the status as a country that had eliminated measles by 2000.
Right. And because it looks like they may not be eliminated if this keeps continuing, Dr. Kazemi, what can be done to prevent this?
Measles usually prevented very effectively by MMR vaccines. MMR vaccine is good for 3 diseases: measles, mumps, and rubella. And this vaccine is given normally later in the age because the antibodies from mother would protect the infant for approximate duration of 1 year. Now, this vaccine is not given prior to 1 year because of the less efficacy of the vaccine had it been given earlier.
Dr. Dixon, what is your advice to parents? I know we have 2 different population groups here that you two represent. You, the children, you, the adults. So what do you tell parents?
I tell parents that mumps, measles, rubella vaccine is safe, it is effective, it doesn't cause autism, and every child should get it at 12 to 15 months of age. I usually recommend 12 months.
Okay. And Dr. Kazemi, recently it's been a big question in my office with my adult patients. What is your advice to adults?
I recommend for teenagers and adults, if they are not immune to measles, to receive 2 doses of the measles vaccination 28 days apart. You can assume immunity if you were born before 1957. If you have a record of immunization, 2 doses of the measles, then you're immune. And also, if you're in doubt, you can do a blood testing called titers for measles, and that can confirm if you're immune or not.
How effective is the vaccination?
The vaccination is very effective and safe.
Why do they get 3 immunizations instead of just getting measles?
That's a great question. In the United States, there is no singular vaccines. And we piggyback 2 other diseases, mumps and rubella, with measles. And the vaccine is very safe and effective, as I mentioned.
And once they get it, how long does it take before it's completely effective?
It takes time for the body to make antibodies against the disease. It usually takes few days before detectable antibodies are in circulation. It takes up to 2 to 3 weeks to be fully effective.
All of us hear this. I'm sure our viewers have heard about and thought about these things. But Dr. Dixon, I'll bet you hear more of it than I do. A lot of parents don't want to vaccinate their children. Can you tell us what their fears are and if those fears have foundation in fact?
Well, I think parents are afraid that they're going to actively hurt their children by giving them a vaccine. And my point of view is you actually harm them a lot by not giving them a vaccine. But I like to ask them, what are they afraid of? A lot of patients, the parents are afraid of Tamarisol. There was a big talk about Tamarisol, and it was a mercury-containing product, which has actually not been in any vaccine for any child under 2 for over 5 years in California. And so it's not in any of these vaccines. Some parents fear aluminum, the tiny amount of aluminum that's in some vaccines that are killed vaccines, not MMR. It's such a small amount, it's considered safe, and it actually makes the body react better to the vaccine, and that's why it's used. And then there's the big fear of autism. That all started by an article that Andrew Wakefield wrote in The Lancet in 1998. And if you read the British Medical Journal from 2011, they published a great article in January about how Dr. Wakefield was hired by a lawyer to prove the case against vaccines so they can sue. And the study was not true. 3 of the 4 authors, besides Andrew Wakefield, retracted their support of the paper that they wrote and said, this is a bad study. And the British Medical Journal finally shamed The Lancet into saying this article was so flawed and this study was so bad that, we retract it. And the reporter from British Medical Journal interviewed some of the parents of the patients in the study. And the parents said, oh, my child had autism before he got the vaccine. We knew that.
Interesting.
Or my child was patient number 12 and they described him wrong.
I think one of the problems is that retraction didn't really hit social media.
No, it didn't. You're right.
And so the other went around like wildfire.
Yes.
And the true story never really made a ripple.
Right. Well, autism and vaccines causing damage are much more interesting, so that got all the news, and it was false.
Yes.
It wasn't news, it was a false story, and the story that vaccines help you, they're very effective, and they can save your life and save your child from a lot of misery is not that interesting, except to us.
I agree with that, and I think, that it is so safe and effective that I would go ahead and immunize my twins, that I recently had with MMR without a second thought.
And that is the best recommendation of all. I would do it for my own children.
Absolutely.
So, Dr. Dixon, if you would just put in a capsule here the whole story about measles.
Well, measles was almost eliminated from this country, but the big anti-vaccination scare that has gone around has led to even a slightly lower immunization rate puts the whole country at risk because the disease is so contagious. And there are people in this country who can't be immunized. So people with cancer can't be immunized. Most, children under 1 are not immunized.
Yes.
And so they're at risk. If there's any measles in the community, they're at risk. And the epidemic I was in Chicago in 89, 90, we vaccinated a lot of people. And when there's an epidemic, we actually vaccinate 6 to 12-month-olds as well to try and prevent it. Because the vaccine's very effective.
Interesting.
It's not as effective in that age group, but that's what we do in high-risk times is give extra vaccine to try and
Better that
prevent
than
it.
nothing.
And it's effective, and it does help. And disease is terrible. I mean, the kids, look like they wish somebody would put them out of their misery. They look awful. They're very sick. A lot of them end up in the hospital. Adults get it too. Adults get sick. It's a very dangerous disease, and the vaccine's very effective.
Well, I really appreciate and was interested by all of your comments. Thank you for participating. And thank you for listening. I hope that this has helped you sort out your thinking about measles. And I really hope you can join us for our next video. Bye-bye.